So, good evening, ma'am. My name is Robert Pisangitan, and I'm here to administer assessing for the skin, the hair, and the nails. So, first, we will need to check the doctor's order. So, checking the doctor's order, it is vital for us to know uh, what to follow and what plans to give to the patient. For our next step, we will be needing to assemble the materials that needed. First, we will be needing the millimeter ruler. Next is the magnifying glass. Next is the cleaning gloves. So, assembling the materials that needed facilitates saves time and facilitates accomplishment of the task. So for our next step, we will be needing to identify our patient. So first, I will be introducing myself. So, hello sir, good evening. My name is Robbie Kanisangitan, and I am your nurse for today. May I ask, is your name Jopasette Teposa?
Yes, my name is Joseph Demosa.
Okay, thank you very much. So what I'm going to do is I'm going to explain the procedure to you. First, we will be needing to assess your skin, your hair, and your nails. So with that, after we gather the information, we will be proceeding to the next nursing care plan. So for our next step again, what we're going to do is we need to wash our hands. So it is our fundamental procedure which we'll be needing before and after the procedure. So we'll be needing to wash our hands thoroughly. So with this, we can prevent the transmission of microorganisms from one place to another. So for our next step, we will be needing to provide privacy for the patient. By providing privacy to the patient, we can gain its trust and its cooperation. So we will be closing the window for confidentiality. So for our next step, we will be needing to ask our patient if there are any signs of pain, itchiness, or any history of skin irritations. We will be needing to identify the skin color, the texture, the patterns, or any irregular shapes in our skin. So first is, I will be asking our patient with these two questions. First is, do you have any history of skin cancer, sir?
No.
No. Okay. So next is, do you lay out in the sun?
No.
No. So right now we will be assessing our patient with his skin. So first is, sir, may I ask to, can you take off your clothes? Okay, so for this, with the patient without the clothes or the upper t-shirt, we can assess the patient conveniently and easily. So first, we will be needing to check the upper extremities of our patient down to the lower extremities. So first, we will need to check the temperature of the patient. If it's warm, the skin is dry. You can observe the skin is dry, starting from the upper extremities down to the lower extremities. So we need to check if the skin is normal. So I can observe that the skin is from it's light, going to the dark brown, and that is normal. So we need to check if your skin is smooth. I can observe that the skin is can check that the skin is smooth. So next is, we need to check for the moles. So sir, can you please turn around for a while? Okay. No. So on the upper side of the body, so I can see that there are small moles here. Okay, so in the middle part, so there are no signs of lesions or any wound in the skin. So okay, next is, okay sir, let's go back to your position. So we need to check for the skin turgor. So for the skin turgor, we need to check if the skin goes back elastically. If it goes back normally, it's normal. So I'm going to check the skin in the clavicle part of our body. So I'm gonna pinch it. It went back easily. So there are signs of normal skin. So next is, we need to check if the shapes, there are irregular shapes in the skin or signs of edema, signs of erythema, which means skin rashes. Next is the jaundice or any signs of yellowish skin. So I can see that the skin is normal. There are no signs of yellowish skin, no signs of erythema or skin rashes, no signs of edema or swelling. So we're going to palpitate if there are any irregular shapes. So okay, so your skin is smooth and thin, sir. So next is we are done with the upper extremities. So we're going to the lower, the leg part. So all right. So as you can see here, we will be checking if there are any signs of, again, edema, or the erythema, the skin rashes, or the jaundice, or the yellowish skin. So right now, I can see that there are no signs of lesions or skin wound. Does your skin itch, sir?
No.
Okay, so there are no signs of itchiness right now. So the skin color is normal. So from the light to dark brown. So it's normal. We need to check if there are signs of um, um, edema or swelling. So I can see that there are no irregular shapes right now. So we'll be checking the temperature if if it's warm. So I can see that the skin is smooth and thin, and that is a sign of normal skin. So give me your arm, sir. We can see that the soles of the arm is somehow thick. So that is normal. So right now we are done assessing the lower extremities of the patient. So sir, you can now place your feet in the going down. So you can now so that will be all. Thank you. So we'll be needing to forward to the we'll be needing to check the hair, the assess of the hair of the patient. Next. So for our next procedure, good evening, ma'am. Leila. My name is Robby Kenneth Pisangitan, and I am the nurse for today of Mr. Joseph So right now, I'm going to explain the procedure to the patient, but before that, I will introduce myself to the patient first. Explain the procedure to the patient. With this, I can gain its cooperation and reduces its apprehension. So, before that, we need to check the doctor's order. So with the doctor's order, we can assure the plan that will go to its proper place. So, and it is vital for us. So right now, good morning, good evening, sir. My name is Robby Kenneth Pisangitan, and I'm your nurse for today. May I ask for the confirmation? Is your name Joseph Deposa?
Yes, my name is
Okay,
Joseph.
thank you very much. So right now, I'm going to explain to you the procedure of what we are going to do. So right now, we are going to assess your hair, the thickness of your hair, everything about your hair. So with this, after that, after obtaining the proper information, we will be proceeding to the next nursing care plan. So in this procedure, what we are going to be needing is that we will be needing clean gloves only. So before that, we will be going to wash our hands for infection prevention control. We'll be needing to wash our hands thoroughly. So with this, we can prevent the transmission of microorganisms from one place to another. So right now, I am wearing the clean gloves. So should not. So right now, we're going to check the patient's hair, the thickness of the hair. So right now, I'm going to start checking it. So I see black colors, no combination of any colors of the hair. So his hair is smooth. Okay, so I can feel that his hair is smooth. So the hair distribution is male. So the pattern of his hair is symmetrical. So um, so next is we will need to check if there are any infestations in the hair or so I see no infestations of the hair. So I see everything is normal. So no signs of lesions. So everything is good. So I see that everything is normal. So that will be all. First is we will be needing to determine the client's history. So we will be asking if there are any signs of any diabetes mellitus, or any peripheral circulatory diseases, or any previous severe illnesses. So the purpose for this is to obtaining a health history is to gather the subjective data and objective data from the patient and the patient's family so that the healthcare team and the patient can collaboratively create a plan that will promote health. So, teacher. So, we needing to wash our hands thoroughly. So, with this, we can prevent the transmission of microorganisms from one place to another. So, it is important to know about the skin diseases elsewhere and examine them generally if we can find it. So next is lastly, we need to perform a blanch test for capillary refill. So the blanch test is it is a pressure applied to the nail bed until it turns white. So this is the blanch test, pressing it so until it turns white and taking the finger off. So as you can see, the color from the nail from white it came back to pink. So this indicates that the blood has been forced from the tissue which is under the nail, and it's called blanching. So we need to check it one by one. We need to check the texture if it's healthy or not. So the color, if it's dark, this determine if the color says malnutrition or the symptoms of diseases in the body. So we need to inspect the tissues surrounding the nails, like ingrown, nana, or infections sa nails. So this is to know if it's in good and healthy conditions without affecting the growth of the nails, of our toenails. Okay, so for documenting, we should always write our result or what we have observed from the assessment. So as this is for the legal purposes, and we can so that we can proceed for our nursing care process, and we could accomplish the task properly and give the proper health care service. That will be all, ma'am. Thank you very much for listening, and have a good day.